Hi, I'm Dr. Burt Webb, and many years ago when I first started working in gynecology, we would take a laparoscope and do some very simple surgeries, something like a tubal ligation. That was considered, wow, that's really special stuff. But I wanted to do more. So I started doing ectopic pregnancies and then advanced to hysterectomies, and I was the first to do a laparoscopic hysterectomy in the Southwest. And I've continued to want to advance. I like doing surgery, and I like doing it in a minimally invasive way. This is the key thing for patients because the scars are much smaller, the recovery is much quicker than any other technique. In addition, we can do it in a way so that there's less pain. So the recovery, the ability to get back to work, to taking care of the family, is much faster. So a minimally invasive hysterectomy is the key to having a hysterectomy done. Now we've come up with some advances, and this advance that's really creating the biggest hubbub is robotic hysterectomies. And the reason the robotic hysterectomy is such a big advance is that it allows me to see things much more clearly, and it allows me to get around corners that I couldn't get around before with a regular laparoscope, and it allows me to see and do things that even with a big incision, I can still do better with the robot. It allows me to do minimally invasive surgery, so the patient has these remarkable fast recoveries, and remove much more difficult uteruses to remove. So I'm able to do more and more difficult cases using the robot. And the robot is really being controlled by my fingers. So it's me doing the surgery. It's not some machine, so you don't have to worry about the machine doing things. I'm able to see much more clearly. I use my feet and my hands that are hooked up to the controls of the robot, and by using those in conjunction with each other, I control the arms and the equipment of the robot, and I'm able to be very precise, have much more finesse, as well as much more strength, like robot strength, when I'm doing any of these procedures. So if you're considering a hysterectomy, you really should consider a robotic technique to make this much easier on you. Faster recovery, less pain, smaller, fewer incisions. I think you'll find that it's a great way to have a hysterectomy that allows you to get back where you want to be much more quickly.